Hi, it's Andrew here from Shelley and Pope Dental Practice, and today I want to talk about swellings. This is one of the emergencies that you might get while we're unable to see you during the COVID crisis. So why would you get a swelling? Well, it's pretty well always because of root canal infection. You can get a root canal infection because the tooth has been decayed, because it's been heavily filled in the past, because it's got a root split, that sometimes happens, or even if you've had a root canal treatment on the tooth previously and that's not working out. So all of those things could cause root canal infection and therefore swelling. Now, most of the time you might get a little facial swelling on the side of your face here. If it's confined to the outside of your face, that's fine. We're going to treat that with antibiotics for you, and we're going to try and keep it under control until we can get to see you properly and get it properly fixed. But there are two situations where you should be worried about a swelling. Don't panic, they're unusual, but if one of these happened, then you should take yourself to an accident and emergency department. The first one is if it starts to involve your eye. If your eye starts to close up to the bottom of your eye, that's okay. Once it starts to move around your eye, then that is potentially serious. Again, don't panic, but there's a little shortcut through the back of your eye into the brain from there. So once infection starts to get towards your eye, then that's something you should be concerned about. So under those circumstances, get yourself to an accident and emergency department. The other one is if the swelling is underneath your tongue and your tongue is starting to rise in your mouth. If that happens, then potentially the infection could move backwards from there into your throat and could obstruct the airway, and you would have some difficulty with breathing. Certainly, if you start to have difficulty with breathing, you need to get to an accident and emergency department rapidly. But please don't panic, those are very unusual situations. Most of the time we're going to be able to control your swelling for you with antibiotics until we can get to see you at the practice and fix that for you properly. In the meantime, I hope you're keeping yourselves occupied. I've got a few ideas for you. If you're stuck in your house, why not teach yourself to juggle, or teach yourself a magic trick, or you can do what I've been doing, teach yourself to play the piano. I couldn't do this a week ago. So please remember that these measures are for the emergency period only during the COVID crisis. If you've got a swelling, then you really need to have professional advice, and we'd be pleased to provide that for you as soon as we possibly can. If you've got any ideas for future videos, then please post them below and we'll see if we can answer those for you. In the meantime, keep yourselves well, keep yourselves occupied, and we look forward to seeing you when this is all over. Thanks very much.